Today I'll be talking about the motor assessment scale. The purpose of this assessment is to assess everyday motor functions in a patient with stroke. This assessment takes a task-oriented approach and assesses performance of functional tasks rather than isolated movements. This assessment is a performance measure, and the area of assessment is activities of daily living and functional mobility. The population that is most appropriate for this test are stroke patients, and it takes anywhere from 15 to 50 minutes to administer. It is mostly age appropriate for adults aged 18 to 64 years or elderly adults aged 65 years plus. The ICF domain is activity, and the administration mode is a pencil and paper. This assessment has 8 subtests: supine to side lying, supine to sitting over the edge of a bed, balance sitting, sitting to standing, walking, upper arm function, hand movements, and advanced hand activities. There's also a 9th subtest called general tonus, and this is observed throughout the whole assessment. The equipment needed for the administration of this test is a stopwatch, 8 jelly beans, a polystyrene cup, a rubber ball, a stool, a comb, a spoon, a pen, 2 teacups, water, a prepared sheet for drawing lines, a cylindrical object like a jar, and a table. This assessment would be done by explaining to the patient what the motor assessment scale is, its purpose, and why you are doing it. You would discuss some of the tests that would be performed so they have an idea about what they would actually be doing. You would then obtain verbal consent if the patient is happy to comply. You then score and record the best of 3 attempts for each of the subtests. Successfully completing a higher level indicates the ability to perform the lower level items that correspond to the lower scores, meaning that they can be skipped, and this saves time. Furthermore, it is also important that the test is conducted when the patient is at their optimal practice. This is most likely in the morning for the older patients. Each item is scored on a 7-point scale of 0 to 6, 6 being the equivalent to optimal motor behaviour. The highest possible score to achieve is 48 when all the items are summed together. It is important to note that the patient has 3 attempts of each item in the subtest, and the best of the 3 is recorded. Michelle is a married, stay-at-home 48-year-old mother of 2. She has recently suffered a middle cerebral artery infarction 2 months ago, which has resulted in right-sided hemiparesis. She was treated as an inpatient at an intensive rehabilitation program for 6 weeks and has been discharged back into her own home as of 2 weeks ago. Following her stroke, she has had reduced upper limb strength, dexterity, and manipulation skills. Therefore, Michelle would be an ideal participant to assess the motor assessment scale on. This is a demonstration on how to administer the motor assessment scale. For this demonstration, only the most difficult item in each subtest was administered. Hi Bradley, my name is Chelsea. I'm going to be your OT today. Today I'm going to do the motor assessment scale with you, and we're just going to assess your motor function. So could you please roll onto your side for me, please? Perfect. Now can you sit up with your feet on the floor at the edge of the bed, please? Perfect. Now you're going to reach down and touch the floor. And on your other side, please. Perfect. Now you're going to stand up off the chair, please. Now you're going to walk up 4 stairs and then turn around and walk down the 4 stairs, please. Perfect. Now you're going to put your arm on the wall and turn to the wall, please. Perfect. Now can we get your other arm, please? And now turn to the wall. Thank you. Now I'm going to ask you to take your thumb and touch each finger with your thumb, and I'm going to time you for 10 seconds. And lastly, just to take this brush and pretend to brush the back of your head as though you're brushing your hair. Cool. Thank you. Here is an example of a score sheet with 4 different areas for 4 different dates of administration. Here is the criteria for scoring the first 3 subtests. Each subtest is broken down into 6 points, with the 6th point being the hardest to complete. I will briefly discuss the psychometric properties, however they will be further explored in my 500-word appendix. So the retest reliability was excellent, with an R value ranging from 0.87 to 1. The inter-rater reliability was also excellent, with an 87% agreement between the raters. The validity had excellent concurrent validity with the Fugl-Meyer assessment, the FMA, and it was adequate to excellent item level concurrent validity between the similar items on the FMA and MSA. There was, however, poor concurrent validity with the FMA in the item of sitting balance, and the R value here was 0.28. These are my references. Thank you for watching.